So looking at a comprehensive approach to injuries of the duodenum, alright, so everybody already knows a part of the intestine known as the duodenum. So if there's a duodenal injury, let me say there's lacerations, there's a tear, there's a complete cut. What is the approach towards it? Alright, that's what we're trying to look at. That's our aim in this video. So first of all, look at the types of duodenal injuries. After looking at the types, we'll look at the causes. What are the possible things that cause a duodenal injury in a patient? All right, look at the causes, look at the symptoms. Like if a patient has a duodenal injury, what are the possible complaints that they might actually present to the hospital with? They look at the diagnosis. That's what you trying to confirm that a duodenal injury actually exists. All right, then even trying to know the type. All right, then talk about the treatments, then complications if left untreated. Okay. So we're saying that what the duodenum is the first part of the small intestine, right? It's a vulnerable structure that can be injured due to various reasons. Okay, so see, this is where the intestine is now beginning with the stomach, and is the duodenum that is the first part, right? So they're telling you that this part can easily be injured, right? So looking at the types of duodenal injury, it could be duodenal perforation, like there's a hole on one side. It could be hematoma, that's what there's accumulation of blood in the duodenum. It could be duodenal lacerations, like there's a cut. It could be transection, like there's complete cut, like this one now. There's complete cut, right? It could be duodenal avulsion, right? Causes. What are the things that could cause any of these injury types in the duodenum? It could be due to blunt trauma, like from car accidents or falls. It could be due to some penetrating trauma. It could be due to iatrogenic injuries, like as a result of surgical complications. It could be due to infections like what pancreatitis, cholecystitis, and the rest. It could be due to some inflammatory conditions like what Crohn's disease and ulcerative colitis. Alright, symptoms. If a patient has a duodenal injury, what are the likely things that they'll complain about in the clinic to you? They'll complain about abdominal pain. They'll see that they are vomiting. They'll see that when they defecate, there's blood in the stool, or when they vomit, there's now blood in the vomit. They'll complain about abdominal tenderness. Alright, when you try to palpate the abdomen, there will be muscle guarding. When you lift your hand from palpation, they'll complain about pain. That's what rebound tenderness, right? Diagnosis. How can you be able to confirm that it's a duodenal injury? Physical examination. You could do imaging studies just to visualize the contents of the abdomen and eventually get to pick up the injury in the duodenum. You could do laboratory tests like a complete blood count, electrolyte panel, endoscopy too is indicated. Treatment. You go from supportive care, surgical intervention, endoscopic intervention, antibiotics. All of these are valid. Complications, right? If there's an infection, it could spread to the pancreas, causing what pancreatitis. If there's infection, it could spread to the peritoneum, causing what peritonitis. There could be abscess formation. There could be fistula formation, where the duodenum will now be abnormally communicating to organs around it, or even communicating to the skin, forming an enterocutaneous fistula. It could lead to intestinal obstructions. It could lead to what? Malabsorption, right? Then I think that's just it for introduction to what injuries of the duodenum, right? Types, causes, symptoms, diagnosis, and